Hello, my name is Garth Reynolds. I'm your Executive Director for the Illinois Pharmacists Association, and we will be going over legislation in review for the upcoming 2019 Illinois Pharmacy Legislative Day. In this review, we will go over and discuss the pharmacy-related legislation from the 2019 session of the 101st General Assembly. We will also describe the status of pharmacy-related federal legislation, primarily focusing on pharmacist provider status. Discuss the status of IPHA-sponsored legislation initiatives for 2019, and describe some of the best practices for communicating and meeting with your legislator. But first, talk about the association. The Illinois Pharmacists Association is dedicated to enhancing the professional competency of pharmacists, advancing the standards of pharmacy practice, improving pharmacist effectiveness in assuring rational drug use in society, and leading in the resolution of public policy issues affecting pharmacists. IPHA is the voice for pharmacy in Illinois. We are the largest and oldest pharmacy association in the state, and we were founded on December 7th of 1880. Druggists of Illinois, elevate your profession, protect your business. Truer words couldn't be said, and that they still apply over 130 years later. This was part of the first membership flyer attracting pharmacists to the need to form an association based here in Springfield. We do that through various different goals and activities for the association, whether it's professional development and developing new continuing education and continuing professional development opportunities, networking for career development, whether it's the government relations, which we'll be focusing a lot of our attention on today, influencing both state and federal government legislative policies and proposals. Societal relations, about how a lot of these practices will impact our relationships with our patients, furthering and fostering additional research in disseminating information about the advancement of pharmacy, of course promoting networking amongst our membership, and developing and fostering a good culture of ethics and standards for pharmacy practice in Illinois. IPHA actively monitors state and federal legislation and regulations that may have an impact not only on the profession, but how you practice patient care. IPHA represents our membership and the profession by educating and discussing our positions with not only key legislators, but regulators. You can find an online real-time report of the legislation that we're tracking at ipha.org under the Advocacy tab where it says Legislative Tracking. This is from our legislative day, I believe in 2016, where we had a very good attendance, and we actually had the governor, Bruce Rauner at the time, who's pictured in the middle, was able to attend and provide a couple of key words on the profession. And this just shows the importance of coming together and being able to voice our opinion as one to our legislators and our elected officials under the dome. But let's quickly review how a bill becomes law in Illinois. So it doesn't matter whether a bill starts in the House or in the Senate, but it does have to go through both chambers to be able to become a law. So when a bill is filed, it is drafted by the Legislative Reference Bureau, or I may refer to it as LRB, and that is a group of attorneys that help take the ideas and formulate them into bills. They are introduced by the House Clerk or the Secretary of the Senate, and that is considered first reading. It assigns the bill number to the bill that's being proposed, and that means it's now an active bill and usually flags up on our monitoring system. Now, they have to be assigned to a substantive committee. So if the bill, once it's introduced in the House, it's assigned to what's called the Rules Committee, or in the Senate, it goes to what's called the Assignments Committee. And those committees are headed up by leadership from both the majority and the minority, and they decide where the bill best fits in the committee structure to have a further hearing, because it has to have a hearing on the bill in a committee prior to coming to the floor. So let's say this was a bill concerning the Pharmacy Practice Act, and it was going to say that all pharmacies would close at 3 o'clock on Sundays. Since this is a Pharmacy Practice Act bill, and let's say we introduced it in the House, it would go to House Healthcare Licenses. And House Healthcare Licenses would address the bill, could provide additional amendments, but in this case they did not, and it passes out. And therefore, it now goes to the House, and it can be considered for what's called second reading. At this time, additional floor amendments may be proposed, but in this case it does not. And then it goes on to what we call third reading, or what you may traditionally consider to be the floor debate. What you think of when you think of a debate in a legislature, whether it's from a TV or a movie. If for some reason the bill would fail, it would no longer be active, at least at this stage. Now, no bill is considered to be completely dead until the end of the 2-year General Assembly session. We'll talk about that here in a minute. But let's say our bill passes. Well, now it goes on over to the Senate and does this entire process again. It gets introduced and goes through first reading. It gets assigned to a committee, which in this case, it's in the Senate, and it's a Pharmacy Practice Act bill. It would go to what's called licensed activities. And if that committee, it passes it, it goes on to what's called second reading, may have additional amendments put through, but this time there wasn't any amendments. So it goes on and can be considered for traditional floor debate. If, let's say, there was an amendment to this bill that says, well, we don't want this to be pharmacies to close at 3 o'clock on Sundays. We want them to close at 3 o'clock on Saturdays. And if that was approved by the Senate, just that change from the Sunday to the Saturday would have to go back to the House and be approved. Not the entire bill, just the change, before it would go forward to the governor. But in the case of our example, we are only looking at a proposed bill that would say all pharmacies would close at 3 o'clock on Sundays. That bill passes the Senate and now goes on to the governor. And we'll look at that here on the next slide. Our governor has a couple different options once a bill is passed. They can approve the bill and it becomes law. And they can actually do that 2 different ways. They can either sign the bill, or they can automatically let the bill become law in 60 days. If they decide to veto the bill, our governor actually has 3 choices. They can either totally veto, say they don't like this idea at all. They could actually take out certain lines out of the bill and say, well, I don't think it should be just Sunday. I think pharmacies should close at all days at 3 p.m. Or the governor could actually issue an amendatory veto and actually state that not only do I agree that pharmacies should close on Sunday, but I think it should be at 6 p.m. and not 3 p.m. Well, either one of these vetoes has to go back to both houses and has to get a supermajority vote, which means they have to get a 2/3 vote. And that's 70 votes in the House and 40 votes in the Senate. And if that happens, then the governor's veto is then overridden. So we just want to use this example to kind of show you the process of how a bill becomes law. And as you go through it a couple different times as bills are actively going through the General Assembly, it doesn't really become that hard to understand the process. But we wanted to kind of highlight this so that when we start talking about this bill is on second reading, or if this bill's in this committee, or this bill is on the veto calendar, you understand what we're meaning by that as we go along. So let's take a look at the 101st General Assembly. The 101st General Assembly started on January 1st of 2019 and goes until December 31st of 2020. It's a 2-year cycle, just like Congress. Congress just started the 116th Congress and will go until December of 2020 as well. In the recent midterm elections, the Senate Democrats and the House Democrats both gained a significant number of seats and further expanded their majority statuses. So much so that Democrats now have what's called a supermajority in both chambers. They now have veto-proof majorities, meaning that the Republicans can all vote for or against something, and it doesn't really matter. It doesn't change the impact of the bill if all the Democrats vote. But most of the parties still want to have some spirit of compromise, and we see that probably a little bit more so in the Senate than the House. But so far this year, we're seeing a pretty good bipartisan reach across the aisle when it comes to various legislation. Our legislature has been very busy already. Now remember, we said that they started on January 1 of 2019, and they've already introduced 6,031 bills and 327 resolutions. That's a lot of legislation and a lot to keep track of. When I talk to my counterparts in other states, they state usually they see between 1,000 to 2,000 bills in any given year, and we're already at 6,000 within the first month of the first 2 months of the year. So it does keep us very busy with keeping an eye on bills. In some slower years, we usually have been monitoring between 150 to 300 bills and resolutions. We are already well over 500 bills that we're keeping an eye on that in some way can become a vehicle for legislation that could impact the profession, or is a piece of legislation that will impact pharmacy or the way you could practice healthcare with your patients. The General Assembly has various committees, as we already spoke about. Now, this is not an exhaustive list of the committees that we deal with, but on normal weekly basis, these are the committees that we are monitoring. In the House has more committee structures, a more detailed committee structure because they have more members. Remember, the Senate has 59 senators, and the House has 2 representatives for each Senate district, so there's 118 representatives. So as in our example, from the slides previously, we had a Pharmacy Practice Act bill, and if that started in the House, it would start in healthcare licenses, and then move over in the Senate into the License Activities Committee. Now, the only addition this year in the House of a very specific committee addressing healthcare, we now have a Prescription Drug Affordability and Accessibility Committee. That's very pertinent to what covers under our umbrella. So we will definitely and are definitely involved with that committee and the bills that have been assigned to it. Once a bill is passed, that doesn't stop the process of our advocacy efforts with IPHA. We also have to help with the various governor's departments in enforcing the bill, and they do that through the rules process. If you remember, there's always an act and a rules. There's a Pharmacy Practice Act and the rules for the Pharmacy Practice Act. And therefore, we usually work with the following departments. The Department of Financial and Professional Regulation, which you know better as the Board of Pharmacy. Department of Healthcare and Family Services, or you know them better as Medicaid. The Department of Human Services, which we deal with mainly as the Prescription Monitoring Program. The Department of Insurance, who oversees the Insurance Code. The Department of Public Health, which oversees some aspects of long-term care pharmacy practice, and specifically the association works with the department in 2 different public health grants at the moment, and the Department of Central Management Services, or Illinois CMS. Now I say Illinois CMS because normally when we think of CMS on a federal level, we think of the Centers for Medicare and Medicaid Services, and that's not what we're talking about here. Illinois CMS is the state's HR department. So we deal with that department in relation to the state employee insurance program and the retiree program, health programs. This is an example list, I'm not going to read all these, of various acts that impact the profession, and we monitor legislation that could impact these. Now again, this is not an exhaustive list. So let's talk about bills that are coming up this year in the spring session. First is House Bill 1442 on oral contraceptives, being introduced by Representative Michelle Musman of Schaumburg. This would add a definition to the practice of pharmacy concerning the prescribing and dispensing of hormonal contraceptives. And in this case, we're talking about the tablets, the patch, and the ring. And this would help establish that pharmacists could, after screening a patient through a self-screening risk assessment, be able to dispense contraception to a patient. And this would be done through a statewide standing order, very similar to how we do this right now with naloxone therapy. And one thing in addition to this, this would help establish pharmacist care services, specifically with the assessment and the consult under both commercial private insurance and under Medicaid. So this would help establish statewide provider status. Right now, this bill is scheduled to be heard in House Healthcare Licenses, and we hope we'll be moving right along the process as we go through this legislative year. House Bill 10 and House Bill 197, both being submitted by Representative Mary Flowers, has to do with pharmacy prescription limits. We dealt with a version of this bill in 2017. In that bill, we were able to negotiate the establishment of a task force to be able to help address the concerns that were brought forward in the bill, and that was called the Collaborative Pharmaceutical Task Force. This task force meets the second Tuesday of every month, at least until the end of this December in 2019, where we'll be producing recommendations to the Department of Financial and Professional Regulations for considerations for changes to the Act. And specifically, we're tasked with looking at whether, in this bill, it looks at whether there should be a technician, at least one technician on duty when a pharmacist is practicing pharmacy, whether there should be limits on how many prescriptions a pharmacist can fill. The bill considers 10 prescriptions per hour. We feel that this is way too low. If we would look at this, even with the most conservative estimate, this would leave about a 40 to 45 million prescription shortfall in the state. And we can't really be looking at trying to be helping with the public health of the state when we would have 40 million prescriptions that would not be able to be filled. It also would prohibit pharmacies from participating in advertising soliciting programs that could jeopardize patient health and safety. We don't have too many objections to that depending on how it's rolled out. It also provide pharmacists with lunches and breaks, and again, we don't have any issues with that. We just need to make sure that we're looking at the definition of what that entails as we consider that for general pharmacy practice. House Bill 13, brought forward by Representative Mary Flowers, would be trying to establish some data and privacy provisions that really kind of repeat what's done on a federal level, both with HIPAA and high tech. And we're actually on record as opposing this bill just because it's a duplicative effort from what's already being done on a federal level. House Bill 53, being brought forward by Representative Mary Flowers, would amend the Illinois Food and Drug and Cosmetics Act to require both brand and generic manufacturers to notify purchasers, health insurers, health care plans, pharmacy benefit managers, and healthcare providers, basically, and the General Assembly 60 days before any increase of price. And it would require the General Assembly to conduct an annual hearing and provide aggregate data trends in the pricing. We're opposing the bill in the current form because we feel that this really wouldn't help address some of the drug pricing concerns that the General Assembly has, at least with how the bill is presented. House Bill 156 that would create the Prescription Drug Transparency Act and require insurers to disclose certain pricing informations to the Illinois Department of Public Health, and would amend the Practice Act to establish some clearer definitions in the way the bill is written when it comes to interchangeables for biosimilars, but we feel incorrectly tries to amend some of the generic substitution language in the bill to try to merge generic substitution and interchangeable substitution, and we feel that the respective sections we have now that separate that adequately address that. We're concerned with the mandated language in there that states that a pharmacist shall dispense the lowest cost interchangeable, including any medication interchangeable that would be on the preferred drug list for Medicaid. We feel that locking a pharmacist into all situations mandate whenever there could be an extenuating circumstance in delivery of medications to a patient that could be then in violation of the Practice Act is not the best way to approach this. So we're opposed to the bill in its current form. House Bill 3232 and House Bill 3414, both addressing prescription drug repositories, and would create the Prescription Drug Repository Act. This would help establish a true standard program for bringing medications that have been dispensed to patients into a process to be evaluated and redispensed to patients. We have long time been against these type of programs just because most of the bills just said Illinois shall create a program, period, and not really helping establish a true process and guaranteeing some type of eligibility criteria and quality criteria for the medications, and establishing some type of civil and criminal immunity for pharmacists and physicians that would be involved in the program. And this bill does, and there was a similar bill that was introduced last year, and IPHA for the first time supported this type of legislation because of the details of the bill. It didn't go anywhere last year because we had to lobby with the Illinois Medical Society and slowing the bill down because the civil and criminal immunity protections was removed from the bill. And we felt that that was vital for the bill to be able to continue, that it had that immunity language, and we're glad to see it back. So we're in support of this bill, and hopefully we can get this bill across the line this year. Prescription Monitoring Program, House Bill 163, being brought forward by Representative Katie Stewart, would amend the Controlled Substance Act and would look at trying to change reporting and controlled substance from the end of the business day to the end of the business day from the next business day. So it'd be shortening that reporting time frame for controlled substances dispensing to the Prescription Monitoring Program, and with some discussions would also be looking at trying to create a true funding mechanism for the prescription monitoring program as well. House Bill 2882 being brought forward by Representative Will Guzzardi of Chicago. This would create the Illinois Generic Drug Pricing Fairness Act, and would provide manufacturers or wholesale distributors shall not engage in price gouging for any off-patent or generic medication, specifically if it has to deal with HFS or any CMS program, so any Medicaid or state employee program. And it could get the Attorney General involved and require the manufacturers to provide additional information about why they felt that the price had to go up to where it was established. And we're concerned with the current version. We're neutral on this bill. We're just concerned with the current approach, whether this would really help address the issue of increased drug prices, because it's going to cause manufacturers and or wholesalers to incur additional legal costs, which would actually cause more costs on the companies, which would entitle them to need to raise the price of medication to cover costs that they're incurring in courts. So again, we understand the purpose of the bill, just not sure if this is 100% the right way to approach it. Many other issues that are dealing with pharmacy, and we're not going to cover all of them today, of course. So we also have Senate Bill 1, which has to deal with minimum wage, specifically $15 minimum wage throughout the state. This actually did pass both houses and was already signed into law. Senate Bill 21 would be looking at increasing the minimum age to purchase tobacco or e-cigarette or vaping products to 21 in Illinois from 18. House Bill 822 would be looking at letting students that have the need for glucagon to be able to self-carry or have more readily accessible access to this medication. House Bill 891, which would look at prohibiting gag clauses in pharmacy benefit manager contracts with pharmacies, and stating that pharmacists would no longer be prohibited from telling a patient if there was a cheaper alternative to their medication. Senate Bill 7 would be looking at making Illinois one of the next recreational or adult use cannabis states. So looking beyond the medical marijuana program that we have right now and expanding to a recreational adult use status for the entire state. House Bill 1441, looking at the possibility of allowing some drug importation from other countries into Illinois. And we have some major concerns about that bill, and we'll be looking at that one and discussing it more thoroughly as we go forward in the session. House Bill 3300 will be looking at some vet prescription limitations and concerning specifically with controlled substances, and House Bill 3500 looking at health departments trying to find additional ways of increasing access in our communities to naloxone. Just as a point on cannabis for a moment, IPHA in December of 2018 took a massive policy shift, and not only do we expanding our original support for some medical cannabis programs, we're now in support of medical cannabis and adult use cannabis. So IPHA supports that pharmacies be the only mechanism for medical and recreational cannabis, and when we say recreational, we mean adult use only, to be distributed to the public utilizing the same legislative manner as we do with controlled substances right now. IPHA would support pharmacist direct involvement in the furnishing of cannabis and its various components for both medical and adult use. IPHA supports the development and promotion of healthcare provider education related to the clinical efficacy, safety, and management of patients using cannabis and its various components. IPHA supports that pharmacists provide cannabis-related pharmacist-delivered patient care services in accordance with the Joint Commission of Pharmacy Practitioners pharmacist patient care process. So in other words, we want pharmacists, as they're dealing with patients with cannabis, whether you're dispensing cannabis to them or not, we need to be addressing our patients, being proactively screening patients that are using cannabis, either medical or adult use, and making the necessary recommendations for the alteration of their current medication therapy to safely be able to use cannabis in addition to what's already on board in their prescription medication action plan. And finally, IPHA supports legislative and regulatory changes to further facilitate the clinical research related to the clinical efficacy, safety associated with the use of cannabis and its various components. So let's take a look at additional IPHA legislative and regulatory initiatives. In addition to the contraceptive bill, this year we'll also be looking at the Pharmacy Practice Act negotiations, and some of that will be done through the Collaborative Pharmaceutical Task Force, which we mentioned earlier, but the Practice Act must be renewed this year. Normally we renew it on a 10-year cycle, and it should have been renewed at the end of 2017, but because of the creation of the task force, it gave us an additional 2-year temporary extension of the act, and we're hoping to at least get another 8 to 10-year extension at the end of this year to help prepare pharmacy practice for what it should look like in 2028. We will be looking at and supporting additional bills not only on pharmacy benefit managers but also with managed Medicaid, and trying to look at true reform for this program and practices that are having a devastating impact on the practice of pharmacy and preserving access to pharmacies for patients throughout the state. We'll be looking at initiatives just like the contraceptive bill, but other initiatives that may help promote state-level provider status, and if we can get the opportunity to introducing legislation to look at pharmacies, robberies, and burglaries. We're seeing an increase in these and violence upon pharmacists in the state, unfortunately, and we want to put in some additional measures to protect our workforce as we go forward. So let's spend some time talking about how to meet with your legislator. So these are some do's. Make sure to introduce yourself and state why you're there. Mention any mutual friends or contacts that you may have. Emphasize key points that personally concern you about the issue that you're discussing with them. But do try to keep it brief. They are busy, and you want to make sure that you're pithy with your comments and as concise as possible. Expect questions and be responsive to those questions, but do not engage in debate and don't be argumentative. Please take a brief synopsis of your key points and supportive material to leave with the member. Now, as if you're attending Legislative Day, we will provide you with talking point sheets to leave behind. Be enthusiastic and show that you care about the issue. This is so important. The more that you're enthusiastic in showing how you feel this issue will impact not only the profession, but most importantly, how to impact patients, because the patients are their constituents, and they want to know how that's going to help them. If possible, try to get commitment of support for the issue at hand, and follow up with a thank you letter, even if you weren't successful in trying to get their support, because they may be supportive with you on the next issue. So it's never a one and done. It's always wanting to make sure that we continue to follow up, foster these relationships, and nurture these champions of pharmacy care. But don't be rude or threaten them. Don't pretend to have any greater influence than you already have. Do not promise something you can't deliver. And don't be self-righteous or all-knowing. Don't be argumentative. And don't be vague about the issue. Try to help them understand. Remember, there aren't any healthcare professionals in the General Assembly, so they have a lot of questions, and they will need to know how this issue will best help their constituents and their districts. Don't forget to thank them, or don't forget to thank the member for past favors. If they've helped you out with supporting of the bill before, thank them for that. If they're a pharmacy champion, thank them for that support in helping us out. But don't bring up past campaign contributions or present them with a check, because they'll end you up in jail. And this all should be done at events, not at the Capitol. Those are for fundraising times, not at the Capitol. So here are a couple of resources that you can take a look at when looking at legislation specifically on pharmacy from a state level. So finally, remember, what we're trying to do with you attending Legislative Day and with this briefing is help you be prepared to be an advocate. Because being an advocate is part of your lifelong obligation as a pharmacist. You're not only going to be an advocate for your patients when it comes to working with their healthcare team, but you're an advocate as a pharmacist to other stakeholders, and specifically with the government, and making sure that pharmacy continues to advance and evolve in the best way for our patients moving forward. And that only happens with your help. So you also have to make sure you stay up to date, whether it's through briefings like this, attending other legislative days every year, or through our installments of our Illinois law updates throughout the year. Make sure you put these legislative changes into practice when they become law. And also, most importantly, maintain your membership within IPHA, and that'll help keep you up to date because of the different farm flashes and CPE programs that we have throughout the year. So again, here's our information. Please do sign up for Legislative Day if you haven't done so already. Please follow us on Facebook and Twitter, where there also is IL Pharmacists, IPHA Annual for the annual meeting, IPHA Foundation for the foundation's activities, ILC Pen for our new Community Pharmacy Enhanced Network. And you can follow us on Instagram at IL Pharmacists, or even on YouTube at IL Pharmacists. And we also have a podcast that we started last spring. And we're up to, I believe, in our next episode will be our 10th episode, where we kind of break down some of the legislative issues in a little bit more detail. So please do subscribe for Illinois Farm Talk. You can do that through either iTunes or the Google Play Store or any of your other podcast apps. If not, you can always find us on Twitter at IL Pharmacists, IL Farm Talk, or at Facebook at IL Farm Talk as well. And again, thank you very much, and we look forward to seeing you advocating for your profession later on this month.